Hi, Dr. John here with NBC News, and welcome to Facebook Live. I'm going to talk about one news thing in general that's been happening over the last couple of days. If you have any viewers' questions, please go ahead and send them to us here. We're going to go ahead and answer as many of those as we can, and that's the main purpose behind this, to get your questions answered about coronavirus and how it's impacting you, how it's impacting the nation, how it's impacting the world. But first off, let me talk to you about one of the headlines you've probably heard about, and that's when things are going to start to open up. And you might have heard a couple of different things. Number one, today the coronavirus task force and the president are going to announce what they need to do, the guidance and the steps that need to be taken to open by May 1st. That's the deadline they're hoping for. On top of that, the 5-state coalition of the Northeast, including Governor Cuomo and governors from other states as well, are saying they look like they're going to go ahead and hold off opening until May 15th. So they're extending that a little over another couple of weeks because they're not sure that those numbers are coming down fast enough. Difference being here that on one hand they're saying we need to get our economy back started and we think the numbers are declining enough and we have things in place to go ahead and do it by May 1st. But this 5, which is actually, I believe, a 6-state coalition, they're saying it doesn't look like that, especially where we are, and so we need to be careful and extend that a little bit further to May 15th. That state coalition, New York, Pennsylvania, Connecticut, Vermont, Rhode Island, and New Jersey, Rhode Island, and Delaware. On the West Coast, it's California, Washington State, and Oregon. Those are the 2-state coalitions. The Northeast State Coalition is now saying May 15th. The reason they're saying it is, number one, this tends to be one of the hot spots, but also number two, they don't think we necessarily have everything in place we need in order to make sure that we can open up safely. And here's what experts are saying that we need. Number one, we need tests to know who is currently sick. And those are the tests, the nasal swabs, the throat swabs that we've been doing for a while. And those give us an idea of who actively has an infection right now, that COVID-19 infection. On top of that, we also need another test called an antibody test. And that test is almost here. There is one test that's been approved, another test, or a bunch of tests that have not been approved that are being used to determine if somebody has antibodies to the coronavirus, to that SARS-CoV-2 virus. If they get sick with coronavirus and they recover, their body should have antibodies to it. Those antibodies should give a little bit of resistance to it. In other words, they're immune to it for a certain time period. We don't know how long that'll last, and we think that's going to allow us to open up more on top of that. But beyond the testing, we also need to have hospital capacity, which means our hospitals have to be at a better level than they are now, especially in the Northeast, and that's why they're holding off for a couple more weeks. And you also need to make sure that you have contact tracing in place. So if somebody gets sick, we need a coalition of people to go in there, find out who was in contact with those people that got sick, and quarantine those people as well. And it might be as simple as you went to a grocery store and were at a cash register of somebody who tested positive for coronavirus, COVID-19, and this group comes to you and they say, hey, you were near that cash register, you need to quarantine for 14 days to make sure you don't have it, so we can quell that uprising of coronavirus that's going to happen if we don't do that. We know once people start getting out and about that coronavirus is going to crop up again. We need to make sure it doesn't get too high because we don't want to repeat what's happened here. Also, on top of that, the coronavirus task force is looking at a nation as a whole. They're saying there are some places, some states that have only had 1,000 or less cases. Those states, particularly the more rural ones, might be able to open up more so than the more populated areas and populated states. Again, this is all one of those things that a lot of experts are talking about right now. A lot of politicians are looking at what they need to do, and hopefully they come to some general consensus and say, this is what we need to do as a nation overall, because that's what we need as a nation. One big policy that covers everybody, and it might be that certain areas open up more than other areas at certain times, but we just need to make sure we have those things in place. Again, testing for active virus, testing for antibodies, hospital capacity, and contact tracing to make sure that we keep any upswing in the cases under control, because those will happen once this starts happening again and we start getting out in public. You're probably going to see, and just so people understand this, when you do go out in public, there's probably going to be some social distancing. There'll probably be masks being worn, especially if you can't social distance as much as you like to. And here in New York, they at least mandated the masks when you're out and about if you can't social distance. And so I think you're going to see more of that. But we will get back to a near normal this summer at least, and we need to prepare for coronavirus coming back in the fall, because it will swing back. At least most of us think it will. We just want to make sure we're prepared for that. But let me see if we have any questions out there from our viewers.
Could you explain why is it called COVID-19?
So the question is explaining why it's called COVID-19. If you remember back when this first started, we're talking February, early March time frame, it was called novel coronavirus. The reason it was called novel coronavirus is because it was novel, it was new, we hadn't experienced this strain before, and it was coronavirus. It was a certain type of virus that there are hundreds of coronavirus strains, only 7 affect humans, and 3 of them cause issues like what's happening right now. SARS, which happened in 2002, MERS, which happened later, and now this one, which is happening to us now, the pandemic. A couple of thoughts here. One is the actual virus itself is called SARS-CoV-2. SARS is severe acute respiratory syndrome, coronavirus 2. The reason they're saying 2 is because it's as opposed to SARS-1, which was the SARS outbreak in 2002. That is the virus. The virus causes the disease. The disease is COVID-19. COVID stands for coronavirus disease 19, because it originated in 2019. If you remember back a few months, December is when we first sort of started hearing a little about it. They think maybe even as far back as November is when they first started seeing cases, that they're finally saying it looks like it might have been there. And so again, they're attributing it to 2019. The way to think about it is, again, remember, SARS-CoV-2 is the virus, COVID-19 is the disease. Think of it like HIV, AIDS. HIV is the virus, AIDS is the disease. Here it's a similar type thing where the virus causes the disease, COVID-19, and that's why they call it COVID-19. But a fantastic question, because it can be very, very confusing. And you'll hear people talk about COVID-19, coronavirus, because that's what we used for months. So those two are essentially interchangeable.
Is this an airborne illness? And if it is, can you explain what that means?
So the question is this an airborne illness? And if it is, can I explain what it means? So this illness is airborne in the sense that it can be transmitted through the air through somebody's respiratory droplets. And originally we thought coughing and sneezing were required, but now we know that even talking, it can be transmitted through talking because it's in the saliva. And some people are what we call very aggressive talkers. When they talk, some spittle comes out, that would hold the virus in it. And if you're that close, then it could happen to you. The best way to think about that on a cold winter day when you see that breath coming out of you. That breath is your respiration. Those are respiratory droplets. So if it comes out about this far, then that's how far the virus is going to get. So if somebody's that close, it could cause an issue. That's why they're saying social distancing, 6 feet, and that's why they're saying wearing masks in case you're not within that 6 feet, because it'll suppress that respiratory droplets from getting out that far. Now, as far as airborne from a medical term, no, it doesn't look like it is. That is more like measles virus. The measles virus can actually get up into the air and hang in the air for a couple hours. So somebody coming through the same area later, even if you're not there, if you had measles, could be exposed to it. This is not the same thing. These are more respiratory droplets. They're heavier. They fall to the earth much faster. There have been some instances in the news where they said it looked like it might have been airborne, but those studies were done in very artificial settings, in a hospital setting where people were being nebulized or they were being intubated. And when they're intubated, especially if it's pressurized air, it can cause it to get in the air and stay in the air much longer. But in the natural environment, out and about, respiratory droplets, and that's why they're saying 6 feet, because that's about as far as it can go. We think 5 feet. And if somebody is talking, again, it can get within a small envelope of them. You don't want to be that close, which is why they're recommending masks.
So it looks like they're talking about testing. Is there, in different kinds of testing, is there a best test for me to go find that I have coronavirus?
So the question is there a best test for me to get for coronavirus? And again, explaining the tests real quickly, there are 2 types of tests we're talking about. One is what we call the RNA test. RNA is the material that the virus is made from, the genetic material. That test is a swab, usually a swab in the nose, a swab in the throat. There's one test that came out that's a saliva test, and that's more so that people can spit into a tube and get their test done. The benefit there is healthcare workers won't have to necessarily be donning the whole PPE, taking the time and using the equipment to do that. But most of the tests are still the swab that go into the nose or to the throat. That tells us if you're sick right now, if you actively have the virus in your body. Once the virus clears out, that means your body has fought it off and it has developed antibodies. Your immune system has developed these antibodies to fight it off. Those antibodies stick around. If they stick around, we can go ahead and detect them with the antibody test. That test is going to help us determine who probably has immunity to it and isn't necessarily at risk from developing it a second time. So if you think you're sick right now, the test you want is that nasal swab or the throat swab, because that's the one that's going to tell us if you're sick right now. If you are already sick, and let's say you're thinking of donating blood for convalescent plasma, which is one therapy they're looking at to see if people who recovered, if their antibodies can help somebody who's sick right now. If you're thinking of something like that, then you'll need more of the antibody test. The antibody tests are few and far between right now. They think within a few weeks we'll have lots of those, and those are going to help us get back to our regular life, but only in conjunction with a lot of other things.
Could this have been a design?
So the question is, could this virus have been designed? The reason I'm getting this question, I've got a lot over the last couple of days, is because there has been in the news some sources saying that it looks like it might have come out of a lab in Wuhan, China. In Wuhan, China, they do have a specialized lab called a BSL-4, which is the highest level of lab for contaminants, that they were looking at coronavirus at the time. The coronavirus, there was some speculation saying, it was a designed virus. We cannot design this virus. Our science is not that advanced to design a virus like this, and it is not a designed virus. They have looked at the genomics, the gene of this virus, and found it came from bats. Now, this doesn't mean that the bats were actively being sold at those wet markets they had in Wuhan, China, but what it means is the bat probably had it, gave it to another animal. They're thinking either the pangolin, which is kind of a armadillo, anteater looking animal, or maybe some of the other types of animals, civet cats or another one they think might have been harboring it, and then from there it jumped to humans, and then it jumped human to human. Now the question is, was the lab involved in testing this, and did somehow somebody get sick there and bring it elsewhere? There's no indication of that happening right now, but a lot of sources, including the World Health Organization, who I know is getting a lot of pushback right now, are saying that they're looking into it actively. So I think time will tell what's going on, what happened in the past. But as far as now, we know it was not designed by humans, and we don't think it was actually leaked from the lab by humans. And so it looks like natural sources, which is typically what happens in these types of pandemics.
Why are they expecting it to come back in the fall? Will it be mutated by then?
So the question is, why are they expecting it to come back in the fall, and will this have been mutated by then? Both are excellent questions. As to why, coronaviruses tend to be seasonal, much like the flu. So what happens is they get suppressed. They end up not being quite as active in the summer because these types of viruses like the cold weather for a couple reasons. They're more active in the cold weather. Plus, we tend to congregate more indoors. We have runny noses and we cough and sneeze more, so they're able to spread faster in the cold weather. When the warm weather hits, they end up being suppressed to a certain extent, not necessarily going away, but not as many cases. And then when the cold weather comes back, they come back as well. And one way to look at that is look at the hemispheres. This mostly attacked the northern hemisphere over the last few months. Now it's attacking the southern hemisphere as they're cooling down and we're warming up. Part of that has to do with travel routes were at the time, but part of it has to do with the weather. So we think it's going to go ahead and get suppressed this summer, we think, but we're not holding any hope out saying this is absolutely going to happen. We can go ahead and go about our business. We're making the steps to make sure that we're protected, but at the same time, we do think it's going to come back in the fall like these tend to do. We just don't know if it's going to turn seasonal every year, how long it'll be here with us, and that's why it's important to get things like the vaccine.
Dr. Torres, high altitude sickness can affect your lungs. Could that be a treatment that we use for that? Can we use it for coronavirus?
So the question they asked is, high altitude sickness can affect your lungs. Can high altitude sickness type medications actually help with coronavirus? One of the big medications we use for high altitude sickness, I'm from Colorado and that's where most of my practice was, is dexamethasone. That's a medicine we use often for that. That would not help with this at this point. On top of that, we also think that people who live in these high altitude areas, there was a news story out a couple weeks ago about Colorado in particular being worse off for coronavirus patients. It was not worse because they were more likely to catch it there. It was worse because once they caught it, their oxygen reserves weren't as high as people on the sea level area, in the sea level areas. The reason being because when you're at high altitude, the oxygen pressure is lower, so the oxygen level in your blood is lower too. For example, in Colorado, if somebody's 92 to 95% oxygen saturation, those are those fingertip probes we put on, then that's acceptable. Here at sea level, like I am in New York City now, we're talking 95, 98% is what we're looking for. So here, if somebody has 98% And we figure they're starting to get in trouble when they drop down to 88% or even 85%. There's a big difference there. If it's 92 to 88 or 85%, it's not quite the reserve. And so people can get in respiratory problems quicker at higher altitude from coronavirus because it is a respiratory illness. And that's why some cases they were looking at bringing people down to lower altitudes instead of having them at 7,000+ feet, bringing them down more to the 5,000 feet Denver type area to make sure that they had more of that oxygen reserve, that they could survive better at those altitudes than at higher altitudes. But as far as the treatments themselves, it doesn't look like those treatments would work well with coronavirus as far as doing anything with the virus itself. But as far as people's lungs and trying to help heal their lungs, it doesn't look like that would work either. Again, lots of news here, and the news is going to continue to come out. Thank you for your questions. They've been fabulous. But look, today they're going to have the Coronavirus Task Force discussions about when they want to open federally. The states themselves are looking, saying, I don't think we're going to open quite as early. We're going to hold off for a couple weeks just to make sure things are under control. And I know we all want to get back to work. We all want to get back to our regular lives. And we all want to get back to doing the things that we love doing. But we need a little bit more time before we can do that, number one. And number two, we need to make sure we're doing that safely. And that means making sure we have everything in place so if this thing starts cropping up again, we're ready to get it under control very, very quickly and make sure that we have what we need to handle it. I'll give you a perfect example. Contact tracing. They think we're going to need anywhere from 100 to 300,000 people across the country to be able to do that contact tracing to find out who might have been around somebody who got sick from coronavirus so those people can quarantine themselves. We don't have that many right now. And so it's going to take a huge effort to get that number of people signed up and trained to be able to do contact tracing to make sure that if something does happen, we get it under control very, very quickly. In other words, there'll be kind of hotspot patrols that'll go around taking care of these different areas to make sure that it doesn't flare into what's happened over the last couple months, because we know, number one, we don't want to repeat that for a variety of reasons, including people getting sick and dying, but also because we know it's going to take an economic toll. That we want to make sure that once we get through this, that we're getting back to our normal lives, or as near normal as we can, until we finally get through it and we get the medicines and the vaccines and everything that can help us get back to a real normal life. Again, thank you very much for listening to this. Number one, first and foremost, please stay safe and enjoy the rest of your day.